Good morning. My name is Dr. Garrick Slate, and I am an OBHG diplomat physician, currently working in the state of Mississippi. I'm here today to share with you a life-save story. It was actually ended up being a really wonderful morning. It was a quiet Sunday morning. I had actually just come on to shift. I had managed to round on a couple of postpartum patients and had sat down at the nurse's station to discuss the patients with their nurses when a lady was brought through the doors of labor and delivery by the emergency medical services, and she was literally writhing in pain on the stretcher. We took her to the first available room, and within seconds of just seeing her condition, the surgical techs immediately had gone back to the operating room and started opening up the OR. Anesthesia was notified by the charge nurse that we had a pending critical situation on our hands, and several of the nurses and myself were in at the bedside with the patient. We were attempting to get heart tones, but it was very difficult due to her moving around, and anytime we would touch her abdomen and uterus, she would grab our arms, push us away, saying that the pain was absolutely excruciating. We were lucky enough to be able to get some heart tones, 120s or 130s, at least intermittently, uh, while the nurses were trying to get IV access and establish a general evaluation of the patient. One of the nurses pulled up the patient's prenatal record and immediately told me that she'd had a cesarean delivery in her prior delivery. And given her clinical situation, the pain that she was in, knowing the prior section, and the inability to really examine her, I made the decision to proceed with an emergent cesarean delivery. We'd called anesthesia, as I had mentioned, and when we rechecked with them, they had a standard of about a 20-minute response time, and he said, in fact, he was a full 20 minutes out. By the time we got IV access and got to the operating room, it was probably about 5 to 7 minutes or so, and I had made the decision that, given the current status of the patient and uncertainty of fetal well-being with the inability to monitor the fetus, that we needed to proceed with an emergent cesarean delivery. I then proceeded to start that procedure under local anesthesia, which none of us enjoy doing, but I felt was imperative at the time. By the time I had reached the level of the peritoneum, anesthesia was actually arriving to the operating room. The CRNA had beat the anesthesiologist there, and they had prepped for a rapid intubation sequence. They were able to get the patient rapidly intubated as I entered the abdominal cavity. And as we entered the abdomen, the fetus was laying within the abdomen, outside of the uterus. I delivered the fetus onto the operative field, and within seconds of delivery, the newborn took a deep gasp and began crying. This was actually a fantastic feeling for everybody in the operating room. And one of the surgical techs even said, if you guys weren't here and we weren't able to go this fast, this probably would have been a poor outcome. With the newborn now delivered, we were able to clamp and cut the cord, and I could further evaluate the situation. The placenta was still attached into the uterus, but what was interesting, and I think what really helped in this case, is that the entire uterine incision line had dehisced and was wide open, and it had allowed the placenta to remain attached and continue performing its function for the fetus. Once I delivered the placenta, I was able to assess the bladder and other structures. And at this point, the remainder of the case was pretty much standard fashion. I was able to spare the uterus, and the patient did well postoperatively. We ended up with APGARs 8-9 and cord gases that were normal. So I think in this instance, it really does show the importance of having an obstetrician on the floor available 24 hours a day, because we were able to assess this patient within literally 30 seconds to a minute of arrival to the floor and proceed with delivery, in this case, having a wonderful outcome, which is the goal of everyone involved. So I think kudos to our system and our mission, And hopefully we have many more of these stories to tell in the future.